The rapidly spreading Omicron variant is becoming a major challenge for the health authorities in Israel. The healthcare system there is struggling to conduct enough COVID-19 tests. Tens of thousands of people crowded into the COVID-19 testing centers over the weekend. At some centers, queues lasted hours. Sunday witnessed 86% rise in the number of tests as compared to last week. This as the number of daily cases crossed the 5,000 mark. Israel has not witnessed a faster surge in COVID-19 cases yet.
And you can see that the line is crazy. I'm not sure that this is the right system to do it, relying on the PCR test as it is right now. And as for the new variant, I'm not sure that the hysteria is making any sense.
The Israel Prime Minister Naftali Bennett said that up to 50,000 people might soon be infected each day, while eligibility for testing could be tightened to help relieve lines at the testing centers. Bennett said that the number of those eligible to be tested should be limited, adding that precedence should be given to those at risk of severe illness and to the essential workers. Sources say the Israeli Health Ministry is planning to revise its testing policies as per reports to be released from quarantine. The ministry is expected to begin allowing unvaccinated people exposed to an infected person to undergo a quick antigen test at the centers instead of an RT-PCR test. The Israeli government aims to set up more testing centers while shifting focus to rapid testing. The health ministry has purchased 20 million additional rapid test kits. PCR tests involve a longer process of sampling, transport, documentation and laboratory services. The antigen tests, however, are easy to administer and provide quick results. Experts, however, say rapid tests are far less reliable than PCRs. Daily cases in Israel are expected to reach record highs in the coming 3 weeks. Over the past 11 days, the daily infections have more than quadrupled. Officials are predicting that by the end of this week, number of new cases could be crossing 10,000. Meanwhile, as countries begin administering a third dose to counter the Omicron variant surge, Israel has announced that it will now offer a fourth dose of the COVID-19 vaccine to people aged above 60 and to the health workers.
Israel started preparing for Omicron early on. This bought us time, which we're using to our advantage. Last week, Israel began vaccinating its most vulnerable citizens with the fourth dose of the COVID vaccine. Tonight, I can announce that Israel will also begin administering the fourth vaccine to all Israelis aged 60 and above, as well as our wonderful medical workers, 4 months after they've received their last dose, following the approval of Israel's Ministry of Health.
WION now available in your country. Download the app now. Get all the news on the move.